Before surgery, there's several different things that have to happen, and some of that depends on the patient's medical condition, and some of it depends on their insurance. So it's hard to give kind of one answer to that question, and when they come for their office visit, they'll meet with either Dominga or Julie, who will go over all of those things with them. But for most patients, there's going to be several months of nutritional counseling, preoperative testing, an evaluation by a psychologist, and then depending on their medical condition, they may need some medical tests like a stress test and other things. For most patients, it'll be about a 2 or 3 month process. It can be as long as 6 months, and that would be kind of the worst case. That would be the longest, 6 months.
In most cases, yes, but it's all stipulated by your insurance, so everybody's individual plans may be a little bit different. And so our team here at the office will take your insurance information, call, check specifically if that patient has bariatric privileges, and if they do, then they'll let the patient know and set an appointment up with them. If a patient does not have privileges, there are other methods by which we can finance the operation, whether it be through self-pay or through a short-term medical loan. The sleeve works first by removing a section of the stomach and taking a 32-ounce stomach and making it essentially a 10-ounce stomach. So 1, it works by reducing the size of your stomach. 2, the part of the stomach that we have now removed is responsible for making a hormone called ghrelin. Ghrelin is a hormone that drives your hunger center. So you don't think about food as often, and then you physically can't eat as much because your stomach is smaller, and you lose weight.
It will last for most patients up to a year, sometimes 2. And so when you put those two things together, a restrictive element where you can't eat as much, and then this chemical hormonal effect, we don't really want to eat as much, it's a very effective tool for losing weight. The gastric bypass works in 4 ways. It works both the same 2 ways I just mentioned about the sleeve. So there's a restrictive element, and there's this kind of chemical hormonal effect where it shuts off the patient's appetite. It's a little bit different than the sleeve, however, because the restrictive element is a little more. So with gastric bypass, the stomach is about the size of an egg. The bypass, in addition, has this element of decreased absorption of nutrients. There's a rearrangement of the intestines that we do that will make the absorption of nutrients somewhat less efficient. That's one of the reasons that we think, it's not been proven, but we think it might be more effective for diabetics. Because of this decreased absorption of sugars, it appears that that causes some of the resolution of diabetes that we see. The easiest way to think about the duodenal switch is it's a combination of a sleeve and a bypass. So we do a gastric sleeve, and then we do a longer bypass than we do with the gastric bypass.
You don't have the hunger drive because you don't have the ghrelin. You have a physically smaller stomach, so you can't eat as much. And then the food travels a particular distance within our intestines before it meets up with our digestive juices that allow us to extract the calories out of the food we eat. And so we lose more weight with that operation.
We are one of the only practices in New Jersey that does that procedure through a laparoscopic, that is a minimally invasive approach. And if you're diabetic, there's very good research about this, about the duodenal switch, showing that even after 20 years, diabetes is still gone in over 90% of patients. So it's quite dramatic. So if you're taking insulin or pills, this is really almost a cure for diabetes well over 90% of the time. On average, the patient will lose about half to 2/3 of that excess weight with the sleeve, about 2/3 to 3/4 of that excess weight with the bypass, and probably 3/4 to 90% of the excess weight with the switch. So you can kind of see how each procedure tends to increase the amount of weight loss. In my 11 years of doing bariatric surgery, I can probably count on one hand the number of people who I thought might have lost too much weight. So while it's kind of theoretically possible, in reality, it's almost never the case. And certainly as long as the patient is following up with us and seeing us in the proper post-operative manner, it's something we'll catch in plenty of time and can very easily treat. So there's no danger of anyone's health being jeopardized by losing excess weight as long as they're following up properly.
that's, again, one of the things that drew me to bariatric surgery and the happy medicine that it is because a patient walks into your office with any number of medical maladies and they basically get to the point of having surgery, they have surgery, and they start shedding themselves of those medical problems. So diabetes can go away at a rate of about 85% after a bypass and almost 90% after a duodenal switch.
Patients who are diabetic and taking insulin or pills are treating their diabetes, and that's appropriate, and they should do that, continue to follow up with their doctor. When you come here, we're looking to cure it. High blood pressure, on the other hand, there is a genetic component, a family history component, so it's not just your weight. And so the high blood pressure doesn't go away as often as the diabetes, but it still does in about 50% of patients. It goes away completely, their blood pressure. And then the other 50%, it improves dramatically. So that is, they used to be on 2 medicines for their blood pressure, now they're on 1, and not only are they on less medicine, but their blood pressure is better controlled. Sleep apnea also goes away about 90% of the time. So most patients, after about 6 months, they no longer need to use that CPAP machine that most patients absolutely can't stand using. And so they're luckily free of that after about 6 months.
One of the common wives' tales is that if a woman wants to become pregnant and then have a happy, healthy pregnancy after bariatric surgery, she has to choose a band or maybe a sleeve. And although it's true that you can choose those operations, it's not true that those are the only operations that you have to choose from. In fact, the most widely studied operation for a woman who becomes pregnant after the bariatric surgery would be the gastric bypass. And what it's been shown is that a woman will have less chances of preeclampsia, less chances of gestational diabetes, more chance of being able to have a normal vaginal delivery versus a C-section, more chance that the baby will be of a normal body weight, not too big, which is the tendency towards which happens to when a woman who is heavy that has a child, the child is heavy. And if the child is born at a normal body weight, they're less likely to be obese as adults.
The short answer is no. However, there will be a period of time after the surgery, usually between 4 and 8 months, where patients notice that when they brush their hair or they wash their hair, that it seems like there's more hair coming out. It's just a reaction to rapid weight loss that as long as you take your proper nutrition, you'll be fine. That's a question that's difficult to answer, but it's one I get frequently. Patients are obviously concerned about that, and there's no way to know. So I've seen plenty of patients who I thought would have excess skin and they did not, and patients who I thought wouldn't who did. So I never try and make a prediction. The only thing the patient can do is to exercise, and that is the only thing that they can do to make their body kind of contour down in the most natural way possible. But even if they exercise, they may still have excess skin. So there's really no way to know for sure.
Regardless of whether or not there is hanging skin, you get the health benefits. So you get rid of your diabetes, you get rid of your high blood pressure, you get rid of your sleep apnea or your high cholesterol, and maybe you have some hanging skin as a trade-off. It might be worth it.
The only way to truly get rid of excess skin is plastic surgery. There are many plastic surgeons that we work with who are experts in this and have an interest in this field of body contouring after bariatric surgery, and we can refer them to any number of surgeons who do that.
It's exceedingly safe. There was a New England Journal of Medicine article that came out in 2009 that basically shows that the 30-day mortality, or the chance of dying within 30 days after surgery, is equal to, if not better than, having your gallbladder removed. Gallbladder surgery is the most common surgery that we do in the United States, in general surgery, which makes it essentially 5 times safer than having hip replacement surgery, or 10 times safer than having a heart bypass or a coronary artery bypass.
It's very, very rare that patients have serious complications or really bad outcomes. Certainly it's possible, and we have a full discussion of the risks with all our patients, but the answer is yes, it's very, very safe in experienced hands, which we are. Most patients are in the hospital for 1 or 2 days. again, we do the surgery laparoscopically, which means we make very small incisions. And so there's not a whole lot of post-operative pain. And so patients are back, recovered pretty quickly. They're usually in the hospital 1 or 2 days. And depending on the surgery they had, they might be out of work 1 to 3 weeks, maybe a month. Tops would be a month, but usually in the 2 to 3 week range.
It's not because the patients are sitting at home with agonizing pain or looking at the wall trying to figure out why they had bariatric surgery. It's more because they're learning their new stomach. And not everybody's job allows them to sit at their desk with a little Dixie cup of water and say, it's time for my hydration, take a little drink. That's not always something that we can be afforded. Some of our patients with desk jobs have been known to go back even sooner. So pain-free usually after the first 24 to 48 hours, nausea-free after the first 24 to 48 hours, usually out of the hospital within the first 24 to 48 hours. And then after that, it's basically learning your new stomach.